Hello and welcome to Sips and Substance, where we distill politics down to its essence. I'm Justin. We have Jonathan over here.
Hello.
And boy, what a week, huh?
It's something.
So yeah, we wanted to talk about the budget this week, but there just wasn't much movement. I think there's talk about Mike Johnson wanting to do a continuing resolution instead of a big tax plan, but we'll see. We need more information. So we want to sort of figure out, well, what are we going to talk about? There's just so much stuff out there, and we feel like it's really hard to get our heading. I mean, a lot of it is really serious, right? The United States cut off intel sharing with Ukraine, and they even told the United Kingdom not to share intel. They told a private company, Maxar, to stop sharing satellite data with the Ukrainians. So Trump is really, really trying to pressure them to capitulate.
Not to mention the cutoff of all military funding.
Right. We started negotiating directly with Hamas, which, in my opinion, is an incredible show of weakness. We're not supposed to negotiate with terrorists, yet here we are.
Policy forever until it's not.
And then who could forget about the tariff war that we started and then stopped? We started again. So,
oh, and in case we missed this, right? Now Trump wants to negotiate a nuclear deal with Iran. Wow. After scuttling the last one. So again, my head is not literally spinning, but if it could, it probably would. It wants to.
Right. So these are all really serious things, and we could devote an entire episode to each of these topics. Some of it's really dumb, right? So we have the Department of Defense combing through all of its images on its websites, trying to find woke imagery, right? If there's a black guy, we got to take it off because, it's woke. It's DEI. I thought the most amusing one was they found images of the plane that dropped the atomic bomb on Hiroshima, and it was called the Enola Gay. And obviously, gay is woke, gay is DEI, and gay is LGBTQIA, and so it has to go, right?
Yeah, I didn't believe you when you told me this. I thought you were trolling me because you have a history of doing that a little bit. But no, in fact, and I'm a little concerned because I've actually been to the Smithsonian Annex where they have the Enola Gay, and I've seen it, and we got to touch it, and I'm worried because I'm too exposed to the woke influence, I guess. I don't know.
And who could forget our friend Ed Martin? He threatened Georgetown University, which is a private university, and said, your curriculum has DEI, and we're not going to hire any more law students from Georgetown University, and you really need to change your curriculum. I really don't think Ed Martin is familiar with the First Amendment, and that's pretty concerning for someone who is the interim U.S. Attorney of D.C.
Well, you mean the First Amendment only applies if you want it to, right? If you're saving the country, you can't break any laws. So there is that.
So anyway, out of all the topics that we could cover, we decided to land on healthcare. I think it's been undercovered a little bit compared to foreign policy, the budget, all the antics that are going on. So we really want to talk about some of the funding freezes that have occurred with the National Institutes of Health, CDC, and various other agencies within the HHS umbrella.
Yeah, and before we get there, though, I wanted to talk about the beer I have for the week. I think it's a good beer. Russian River really does need to give us a sponsorship because I have another Russian River beer because my local store had a really bonanza shipment of different things. We have Damnation this week, which I think sums up the way that we're kind of feeling this week and we're kind of lost. But anyway, what's interesting about this beer, Russian River has two strong suits in beer. They make really solid IPAs and they make really good Belgian-style beers. And this is a Belgian-style golden ale. So it's a very, very solid beer, very tasty. It's got a little bit of that spicy clove kind of banana bubblegum yeast flavor going on in the background, and it's just very mellow, very kind of warm beer. Perfect beer if you're feeling a little lost at sea. All right, so as you just said, we're going to talk a lot about healthcare today, and we're going to talk a little bit about, before we get into what's going on and why we should care, a little bit about how our healthcare organs are structured in the United States. Talking first about HHS and then getting a little deeper into the FDA, CDC, and NIH. I know you wanted to give us a quick take on this, Justin, so why don't you take it away?
Yeah, so every aspect of government has been touched by these mass firings and funding freezes, right? So within HHS, you have various agencies, and I'm sure you're familiar with several of them. So FDA, right? They deal with medical device safety, drug safety, food safety. CDC, so we just went through COVID. They're in charge of, disease control. And then there's the National Institutes of Health. So that's basically an umbrella agency that deals with various institutes of health. So one of them might deal with cancer research, another one might deal with Alzheimer's research, what have you. I think there's something like 29 of these institutes, right?
Yeah, and generally, I think useful to reinforce is just they're the research arm, basically.
Yes. So if you combine all these agencies, their total budget is, on the order of 50 billion, right? Now you compare that to the entire HHS budget, it is a fraction. So the CMMS, so they're the ones who allocate the Medicare and Medicaid funding, that's over $1 trillion. So I just want everyone to keep that in mind. You have 50 billion versus $1 trillion, right?
Well, I think one of the reasons these things get overlooked, right, is because it's not convenient for Donald Trump and Elon Musk and the rest of the MAGA types to make that very public, right? If Trump has said we're not cutting Medicare, right? He said we're not cutting Medicaid, but it seems to be on the table now. But if you're not cutting the big things like Medicare and Social Security, which is another one, the only place you can find cuts and you're not cutting defense are the small agencies like the FDA and the CDC and the NIH and other places throughout the government. And so these people end up getting gutted because if you want any kind of savings, it's not just a rounding error. You have to really hollow out these smaller agencies. And even then, the total impact on the budget is going to be pretty minimal.
Right. So these agencies, they're not like these deadbeat agencies, right? They're incredibly useful agencies. I'm sure everyone remembers Operation Warp Speed, right? So the development of the COVID vaccine. This was all made possible through collaboration with all these agencies. And say what you want about Trump, but this was one of his greatest successes in his first administration. The COVID vaccine saved millions of lives. To really drive home the point here on how useful these agencies are, from 2010 through 2019, the FDA approved about 350 new drugs. So the exact number is 356. NIH helped fund 354 of them. So all but two. So NIH, through their grant program and research arms, have had a tremendous impact on our lives. So for all these things that Trump does, I feel like you can find some sort of motivation, right? And I think for NIH, FDA, CDC specifically, it's really hard to find a motivation to go after these programs. And I'm of the opinion that they're not going after these programs specifically, right? I think that these are just casualties of a greater war. So yeah, there's the war on woke, right? You have the war on government employees. And, I think some might argue that there's a war on science going on, but, I'm not convinced yet that it's happening. I think it could happen eventually, but as of now, I don't think that's what's happening.
Yeah, I'm going to take the opposite view and push on that a little bit because I think I'm going to be a little bit more pessimistic. I think there is a war on science going on, but not just because it's science. I think this all part of sort of the Republicans' sort of campaign, which has been a war on elites, which has been going on forever. And a large part of what they've been doing for years is trying to discredit the elites, right? And we'll put that in quotes because they don't really define what elites mean other than not them, right? So there's real Americans and there's elites. And if you're part of the elite, you're part of the problem, okay? And obviously these scientist types and these academics, they're part of the elites, they're part of the problem. They're trying to tell us that they know better, but they're not real Americans. We know better. And I think that's what makes it very easy for Trump and his allies to say, hey, look at all these people we can cut here because here's these elites trying to tell us that they know better than we do. And so I think that you're right. It's part of a larger war, but I think that larger war is part of the whole, Republican assault on establishment. And the elites, the attack on elites is part of that. And this kind of comes from that. And I think it's useful to remember that a lot of this comes from the Project 2025 folks that are more than just Donald Trump MAGA acolytes. They're also, probably first and foremost, far right conservatives who are just building on the themes that they've been after for a long time. And they see Donald Trump as a good way to get these things done.
Right now, I think we're seeing this three-pronged attack. We see, one, they're going after the funds themselves, right? Two, they're going after the personnel. And three, the people who remain and the funding that remains, you just have this culture of fear. And so that's where this war on woke comes into play, because people are afraid to do their jobs now. They can't do their jobs effectively because they'd rather keep their head down and try and do as much good as possible. And they're honestly afraid of, oh, if I approve this grant, will I get fired?
Yeah, and I think it's even more than that. I think it's even more than do as much good as possible. I think a lot of it is just self-preservation, right?
Sure.
And I don't think we should necessarily look down on these people. It's easy for anyone else on the outside to say, hey, you should stand up for what's right and get fired. And it's one thing if you're a high-level public servant and you got plenty of stuff that you can fall back on. It's quite another if you are a mid or low-level researcher in some organization, right? There's not infinite number of jobs out there for these people where you want to live. So I think the self-preservation aspect is definitely something we should think about. We think about why we're likely to see even more damage than simply cutting funds.
Right. So let's talk about that, the funds thing. So early on in the administration, there was this blanket freeze of all spending, right? And inevitably that affected CDC, FDA, NIH. And since then, that has been enjoined, right? They had to come up with new executive orders that said, okay, fine, funding can go through. But
meaning the court stepped in and said,
right.
You can't do this. Yes.
And we've come to realize that, well, not all the funds have gone through. So we're going to go through why that is. And right now, there seems to be this political battle between the attorneys at HHS and NIH who are seeing these court orders and they're saying, look, we have to do this, right? And yet there are people higher up in the ladder who are communicating with White House staff and they're saying, no, we need to come up with other justifications to do what Trump wants, right? So if the court says do X, well, let's come up with another justification for why we can avoid doing X, right?
Yeah, this is just, we've talked about this before. We talked about the impending or not constitutional crisis of the Trump administration just saying, yeah, no. And they're not quite there yet, right? As you're saying, they're trying to come up with other legal explanations for why they're not going to do what the lower courts want them to say. It will come to a head when the Supreme Court tells them to do things and they decide, well, no, then we'll have an issue and we'll see what happens. Right now, as you mentioned, they're still trying to kind of weasel their way around while essentially ignoring the courts, but not coming out and saying, we're ignoring the courts.
Right. It reminds me of the Muslim ban early on in the first Trump administration, right? They came up with an executive order. Court said no. They decided to do it differently. Court still said no. And they finally were able to come up with some justification that passed muster, right? So the way they're getting around this spending freeze is NIH is saying, all right, we're going to put a 15% cap on indirect costs, not only on future grants, but existing grants. So what does that mean? So the direct costs relate to the actual research, and the indirect costs is basically anything that involves overhead, right? So building space, shared lab equipment, disposal of, biohazard material, equipment maintenance, what have you. A lot of this stuff is indirect costs. And NIH's argument is, well, we need to be in line with the private sector. And the private sector is somewhere around 10 to 15%. And if you look at some of these elite institutions like MIT, Harvard, Stanford, what have you, it's well above 50%, right? And, the institutions, they in theory could be a little bit more creative, right? And they could say, okay, well, if we break down how many hours we're using this particular building, we can come up with, how much electricity we're using. Well, we're only using this piece of equipment for 2 hours out of the week. They could do all that, right? But they actually can't because NIH has rules forbidding a lot of that sort of creative accounting.
Well, and part of the thing that this sort of illustrates is the ridiculously elevated business approach. And I think everything should be a business approach to government, right? If you think back to the statistic that you mentioned earlier, which I think is very useful, that 354 of the 356 drugs approved were funded by the NIH in some way or another, right? That's because in the private sector, if you don't succeed, you go out of business, right? In the research field, you're not going to be successful every time. For a long period of time, you're not going to have a successful drug until you do. If the government pays for that, right, we have a lot of things with essentially a waste of money because they didn't work out, but sometimes they do work out, and then you get your 354 out of 356 drugs. So you're going to have waste when you do actual research. When you're in the private sector, you're doing much more motivated research for something that you are pretty sure is going to pay off, whereas academics will pursue a hunch, and sometimes it works, sometimes it doesn't. But it seems to lead to most of the drugs that we discover in this country.
Right. And, some may argue that, well, can't venture capital do the same thing? Well, what is venture capital trying to do? They're trying to maximize profits.
It'd be the same kind of thing that I just described, basically, right? You're a venture capitalist. You're not going to go to somebody that's like, yeah, I'm going to play around with these things and maybe I'll come up with something in 10 years. It's like, what venture capitalist is going to go for that when they can do something else with a quicker return?
Yeah, and maybe they would, right? There are some venture capital firms that do think long term, but think about what is a profitable drug. It's going to be the things that affect the most people. Now, what about rare diseases, right?
Yeah, exactly. Yeah, there'll be absolutely zero research into rare diseases,
right?
And less research on the things that might be game changing because it requires a lot of speculation and a lot of trial and error.
Right. So we always have to keep that in mind. The goal of government is to protect people, and the goal of venture capital is to make money. And oftentimes they go hand in hand, right? But when it comes to rare diseases, definitely not.
But the other argument would be, well, if it was profitable, they'd already be doing it, right? Nothing about the NIH prohibits private investment in drug research. If it was really profitable, they'd get behind it. They don't so much because they don't know. It's a crapshoot.
Yeah. So either way, right? We could have this debate on what the right amount of indirect cost caps are, but at the end of the day, a lot of these budgets have been set. They're ready to go. So that's just another obstacle for researchers, right?
And they're not interested in having a debate over what the proper level of this funding should be. They're interested in throwing up a roadblock and say, see, we can't fund these people.
Exactly. It's not a good faith effort at all.
Nope.
So anyway, the courts have stepped in and said, you know what? We see what's happening here. We're going to have a temporary restraining order, and it was granted. And so NIH has come up with another justification to halt funding, and that is through the bureaucracy. So there is a rule that you have to submit to the Federal Registrar 15 business days in advance that you're going to have some sort of meeting to review these grants. And so what are they doing? They're preventing these things from being submitted to the registrar. And it wouldn't surprise me if there is some sort of court order sometime in the future, but it seems that they're just having a little bit of a trickle effect. They're going to have some of these meetings go through the Federal Registrar, but is at a much lower rate than what you would usually see.
All right. So along with the funding freezes and cutbacks and all that stuff, as you mentioned, sort of the second prong of what they're doing is personnel cuts. And the CDC had like a tenth of their staff laid off, and they're making big cuts at the FDA, right? And NIH is getting cuts as well, right? And again, it's like just random, right? They're going through with their chainsaw approach that Elon Musk is so happy to demonstrate, and they're firing people left and right, and then saying, well, kind of, oops, maybe we fired the wrong people. So they're having to hire people back, people that are in charge of investigating avian flu in cattle. people who are in charge of, other things in food safety, people who are in charge of investigating diseases, right? People who are in charge of approving medical devices, which I think is the most telling of everything they're doing, because the people that were fired were not even paid by taxpayers. They were paid for by the industries that they regulate. And the industries are like, excuse me, we need these people to approve our medical devices. We're paying you to have these people, get them back. And they did.
Yeah. So most of this stems from going after probationary employees, right? So Elon Musk and his group thought, hey, you know what we could do? If we just go after the probationary employees, they're new. And if we go after these new employees, well, we're good, right? Well, no, not quite, because a lot of these probationary employees were people who've been there for years and they just got promoted, right? So there's a lot of expertise there that just went away when you did this chainsaw approach.
Never mind the inconvenient fact that you're not allowed to fire probationary employees in the government unless they've done something wrong and been bad employees. And they're saying, oh, yes, all of these people didn't do their jobs, but you've made all these decisions like that without reviewing or talking to anybody. And if that gets in front of a serious court, I can't imagine you can demonstrate that, yes, in fact, we reviewed everybody's performance and came up with all of these people were bad, and they just happened to all be probationary. And it happened to be every single probationary employee in these certain departments. So yeah, it's, again, the good faith is completely lacking.
Right. And it is in the courts, right?
Yes.
But the courts are slow. Even if you get an injunction, you're not getting paid for a while.
Well, and again, we should remember that Trump has gutted the National Labor Relations Board, so they can't even meet and they can't even rule on certain things, which is, as you just kind of mentioned with the commission, the committees that need to meet on grants, same kind of thing with labor. If you've done this and these things can't happen, then there's no avenue to really appeal these decisions that aren't being made. So they're getting in the way with bureaucracy.
Right. And so this is the strategy, right? They know that they will probably lose in the end. Maybe there's like a 5-10% chance that they do win in the end, but they don't care about that. What they care about is getting their agenda through quickly, and they're hoping that a lot of these people, they're effectively starved out, right? In the show notes, we have someone who got rehired and a university picked them up instead. And this is where you're going to just see this massive brain drain to the private sector. And hopefully it just is within America, right? Because a lot of these people might go international, which would be catastrophic because you're never going to get those people back. So even if you get that job back, maybe it gets cut 6 months later, right? There's just no certainty that you're going to have that job. And so there's just this cascading effect on personnel.
Well, and certainly if you are working in one of these agencies, if you're not looking for a job right now, you are kind of silly, right? It's sort of, you would think normal, and it is sort of normal way in terms of jobs, that if you know your company is laying people off, you look for something else. Better to find a new job first before you get fired. And people in the government are certainly thinking that way. I know some people who are, and it'd be fools not to.
Yeah. So it's just this, it's just so dumb, right? This chainsaw approach. And it's just embarrassing when you have to hire people back that you need. As you mentioned before, the people at the USDA, Department of Agriculture, who were on the front lines dealing with the avian flu outbreak, what the hell? So the third prong that we want to talk about is this culture of fear, right? And this is where this anti-woke crusade comes into play. So if we go back and we look at these DEI executive orders, the first thing that these people tried to do is they tried to comply with the order, right? These people just want to do a good job and they're scared about pissing off the man in charge. And so early on, they were just removing critical data left and right from the websites, right? They had a pause on all external communication. And so this caused complete chaos early on in the administration. This was before the funding freezes, right? And so in the show notes, we have a series of tweets from USC professor Darby Saxby, and there's basically a chart where they're looking for specific words. So we made a reference to the Enola Gay early on, right? So there are some words, lots of words that are flagged. So BIPOC, Latinx, LGBT. So yeah, those are woke terms. But there are also other terms such as women, biased, trauma, which is just insane, right? If you're looking for statistical bias, that's going to be flagged. Again, this is like a chainsaw approach to the grant process, and it's just causing people to freeze up.
Well, I mean, I'm going to go further than you again on this one because in good Orwellian fashion, as I'm a very very large fan of big fan of George Orwell, I can't get behind any sort of effort to control language, right? When they complain, oh, the wokies are using this language and this, okay, that's legitimate, but now you're going to do the same thing and you're going to control language from your perspective. How is that any less legitimate? Any less illegitimate? It's just not. And I agree with you that it induces a lot of fear, but I think it induces even more fear just because of what they're trying to do at the heart. They're trying to get people to stop thinking in these terms, right? If you remove, it's sort of the Orwell premise. If you remove the words from the vocabulary, then you can't think about these things. And they think they're going to do this with the woke stuff. When in reality, it's just like, I mean, there are extremes that the hardcore wokies go to, but to pretend these things don't exist as terms or words or concepts is just silly and potentially very harmful, right? I've never been a fan of, hey, I'm going to tell you my pronouns because then you're telling me how I use language. So I've never really been a big fan of that. But then when you're going to tell me you can't use these words, to me, that's even worse.
Right. And, whatever you think about woke and gender ideology, it doesn't matter because there are some realities that we have to contend with. It is a fact that gay men are more prone to HIV. We need to have that data so that we can treat people.
Well,
right?
I mean, beyond that, right, it is a fact that gay people exist. If you eliminate the LGBT terms from all your posts and data, these people will still exist, right? You're not getting rid of anything other than the terminology. And that doesn't do anybody any good. If we have fewer ways to communicate about things that actually exist, we're much worse off as a society.
Yeah, it makes you wonder about monkeypox. We were able to stop monkeypox pretty quickly once we found certain trends.
Yeah, and again, if you couldn't do research into the LGBT community, that would have been a problem.
Right. And also, Black Americans, they are disproportionately killed by cancer. We need to know this information so that we can treat them. So why does all this matter, right? We mentioned before how important NIH funding is for research. We mentioned how many drugs were approved that had some level of NIH funding. And the reality is the American government provides more research money for health than anywhere else in the world. If we start freezing this up, not only is it going to affect us, it's going to affect everyone worldwide. And the reality is there is demand for healthcare research. What is the point of it all, right? What is the point of life? To live longer. And to live longer, we need access to healthcare and the best drugs, the best medical devices, the best treatments. And, I'm sort of reminded about COVID supply chains. Remember when there were shutdowns in, China, and that affected the microprocessor industry, which affected the car industry. And there's just this cascading effect. We're going to see the same thing if these draconian cuts and firings keep on going, right? The grant money that goes to universities and commercial research, well, if that dries up, well, then you're going to have less people going to grad school. You're going to have less jobs in the pharmaceutical and medical device industry, so on and so forth. And when you and I need medical care, we're not going to get the latest and greatest anymore. It's going to take years to fix that.
Well, I mean, first, I'm not necessarily going to agree with you that the purpose of life is to live longer, unless we're talking about an evolutionary sense. But we can get it. That's a whole other discussion. And I'm not as concerned about the brain drain, right? If people do actually go and work with other countries, because international, pharmaceuticals are kind of international. For example, like Ozempic and all that, that's coming from, what is it, Finland, I think?
Finland, Denmark, it's one of the
Something like that.
Scandinavians. Yeah.
And so drugs will make their way here. If people discover new drugs, they'll make their way here. But I think the point that you make that is useful and important is that it can take a while to adjust a system. So when you have a shock to the system, it can set research back a couple years. And in the long term, it doesn't matter so much. But if you're suffering from one of these diseases that's cured a couple years later than it might have been, that can be a real problem because you might not be around in those couple years. So I think definitely these things are going to have impacts on people. But I think if you want to look at the harm that's coming, it's not just going to come from the funding and the firings and the fear. I think, I wanted to talk a bit about how their whole approach to healthcare is what's really going to hurt us, in my opinion, right now and going forward.
I don't know. Before you do that, though, I do want to push back on this.
Okay.
It's like, yeah, maybe other countries pick up the slack eventually, right?
Sure.
But why are we giving up this space? To me, that's crazy.
Sure. I agree with you completely that we shouldn't.
I want America to be number one. America should be number one in everything. America should be the best of the best.
To me, I tie this back to what we talked about last week with international relations. Like, nobody has ever, again, in the best of my knowledge, willingly and voluntarily given up the position of number one power in the world.
Right.
And we seem to be happy to do that. Same kind of thing is happening with this. We are the number one player in medical research. And of our own accord and devices, we seem to be happy giving it up. And I think I agree with you. It's a ridiculous position to take. But it seems like that's what the government wants to do.
Yeah. I mean, just think of all the industries that the public-private relationship has created, right? Nuclear energy, aerospace, semiconductors, the internet.
I agree completely that the firings matter and the cuts in research matter too. But overall, I don't see it mattering as much in terms of a similar approach to how I didn't think it was all that important who Trump put in charge of these agencies and who he appointed, because I think they're all going to do what he wants. Well, over in the health area, I think it's a distraction because the public health approach is what's changing completely, right? We're changing from a science-driven approach to what can be charitably called an ideologically driven approach, but more realistically called just an idiocy-driven approach, right? We are changing our public health stance, right? We are taking data down that's important medical data because we don't like the way that we don't like the conclusions it makes, whether they're woke conclusions or conclusions that go against the anti-vaccine whackpots. But this data is disappearing. And that's a problem for scientists and medical researchers, right? We are pushing crackpot treatments again, right? I thought maybe we were done with that after the hydrochloroquine business with COVID that Trump was behind. But nope, we've got more of that. And we'll mention that more in a minute, right? We're challenging established drugs just because we don't happen to like what they do, right? Number one, the abortion kind of drugs. And we're saying that vaccines are a personal choice at best, right? And it's going beyond that, right? Most recently, or not most recently, but very recently, the CDC canceled their flu vaccine meeting. They have an annual meeting. They get together, all the scientists and medical researchers, and say, these are the flu strains we're likely to see. This is what the vaccine should cover this year. Well, we're not doing that this year. And that's a potential problem. We might not get our flu vaccine in time. There's the WHO is giving out some recommendations. So hopefully drug companies will take that if we're going to completely abdicate. But it's just the general approach that, you know what? We don't really care about public health as much. It's up to individuals, right? Look at the measles outbreak we're having in Texas and New Mexico right now, right? Kennedy has sent some vaccines down there, and he's talked about vaccines potentially being effective, but he's made it perfectly clear 100% that it's a personal choice. And in fact, physicians are that he's recommending that they use cod liver oil to treat measles, even though it has absolutely zero impact on the way that people progress through a measles treatment. And we've had deaths, and it seems like there's at least one more. At least it was somebody who died yesterday who was not vaccinated, had the measles, and died. They haven't figured out exactly why, but seems to probably be connected, if I had to guess. And, it is a personal choice. If you want to get vaccinated, sure, I guess, but it's not a personal choice if you're, say, under 12 months old and you can't get vaccinated and you die because some other idiot didn't want to trust the science. And so what we're getting, I'm going to tie this back to what I talked about before, in this idea that we're against elites and we're not going to let them tell us how to do things. We're going to let average people decide what the public health policy of the United States is, right? Because if you choose not to vaccinate, we're not going to have herd immunity. And measles is going to spread throughout the United States to people that can't get vaccinated yet or who vaccines don't work on because they're immune suppressed, right? And this, to me, is the real harm. We are taking our approach to public health and saying it's no longer science-based. It's what we want it to be for our ideology, which just happens to be, we don't trust science. We're going to do our own research, which is just ridiculous because the people that are opposed are not the people that are capable of doing research because they all understand, hey, this is the science. This is how it works, right? You see something similar, and I'm about to end my rant. Let you jump back in. With what the new FDA, I think the head who's nominated was talking about at the hearings, at his hearings the other day. He's saying, yes, well, mifepristone, which is the abortion pill, right? Oh, it's still available, but we're going to look at the data and see if we want to keep it being still available, more or less. Right? When the actual reality of it is mifepristone, I mispronounce that every time I say it, is much less dangerous than, first, Viagra, and second, things like Tylenol, right? Mifepristone is amazingly safe in terms of people who die while using it, except it doesn't fit in their ideology. So they're going to go after it like you won't believe. And you can rest assured they're not going to go after Viagra because they have a number of old men who are not going to want to mess with taking away their Viagra. Abortions, that's not their issue. So we can take that pill away.
Yeah, I mean, I've definitely been in the camp that, you know what, if you need to touch the hot stove, go on and do it. But at the same time, I take your point about this affecting people who don't have a choice, right? The infants who are, say, 8 months old and aren't eligible for the MMR vaccine. What do we do about them? And, the one thing that keeps me up at night is, we just lived through the pandemic. So these lessons should be really fresh in our mind. We saw people who rejected the COVID vaccine. We saw them on their deathbed in the hospital, regret it, and then they died. What happened? Is our memory that short? So I don't know. It gets kind of depressing, but I don't know.
Yeah, it's very depressing, and I think it gets, to me, a little more depressing when I kind of play this out as like it's not just in the health sphere, right? To me, this is very emblematic of the Democrats' challenge overall. It's that people feel empowered to believe any stupid nonsense they want. The number of Americans that believe QAnon is a thing, or that the election was stolen, or that Bill Gates was behind injecting us with microchips when we were getting what was not really a vaccine, or that the COVID vaccine, which is something Kennedy is behind, by the way, was engineered to not affect Asians and Jews, Ashkenazi Jews in particular. People feel empowered to believe any sort of bullshit they feel like these days because they can encounter other people who reinforce their beliefs online, right? And you get idiots in the government, like our current HHS director, who support and push these same conspiracies, right? And the reason, I think this is really troubling is that the GOP is pandering to a lot of these people because they're loud, right? And they're sort of a pliable constituency. They know they're getting their hardcore Republicans. If they can pull in these people, then they're going to win, right? Which they did last time. The Democrats don't have a way to counter this right now Because how do you reach people that aren't interested in believing reality? I mean, essentially, you need to convince people, hey, you know what? You could be wrong, right? And there are things that you're not in position to judge. There are experts that know some things better than you do. But people don't want to believe that. A subsection of the population doesn't want to believe that now. And to me, that's a huge challenge for the Democrats to break through that.
Yeah, I mean, we'll see what happens. There's definitely going to be some external factors that just change the game in ways that we can't even
Certainly.
predict right now. I hope that this episode was somewhat infuriating, right? I mean, that's the goal, to inform and let you
Damnation,
know
right?
what's at stake. But I also understand that you can't be mad at everything. So, as I said before, and platinum level listener Senator Alyssa Slotkin said in her response to the State of the Union, find an issue that you care about and just focus on that. Do not disengage, because as soon as you disengage, they win. So
I think that's a really good message to end on, because don't expend your energy everywhere, but make sure you focus on the things you like. And that's why you'll see me giving rants about RFK on a regular basis, because I just that's my issue, at least right now. This week, anyway, it'll be a different issue next week, but I can easily be riled up by him when he does something ridiculous again.
So, anyways, make sure you tell your friends, like, subscribe, do all those things, leave a comment. We'd love to hear from you, and we'll see you next week. Bye-bye.
Bye bye.